Hello, my name is Demita Wilson, and my presentation is called Cultural Issues for the Native Americans. Why are cultural issues important in psychotherapy overall? Well, some cultural issues may cause certain populations to be exposed to a higher number of risk factors for psychological distress. The view the population may have on family, religion, and gender roles can influence how they approach therapy. Ignoring or reducing cultural considerations can lead to ineffective treatment and, in some cases, harm the individual. It is important to avoid bias. Therapists should not impose their beliefs onto their clients. Behaviors and goals could then be misconstrued. What cultural issues surround processing of trauma for the Native American population? Well, colonization and loss of land has left negative impressions on the Native Americans. Also, the history of the disruption of spiritual practices and land is intertwined with trauma, leading many to require healing and efforts to address this. And then the systemic inequities that include and not limited to discrimination and historical abuses may deter this population from seeking help. Factors impacting access, engagement, and the use of psychotherapy after trauma. Some Native Americans still turn to traditional health practices and spiritual leaders instead of going through mental health therapy services. They may experience cultural incongruence with the chosen therapy methods. They have a mistrust of non-native providers, and they have a lack of knowledge about mental illnesses. Population definition for the Native Americans. The needs of the community within this population take priority over individual needs. They have ceremonial powwows and seasonal gatherings to promote cultural continuity and community bonding. Many believe animals, plants, and natural features possess spiritual importance. Traditional medicine mixes physical, emotional, and spiritual healing through the use of herbs, rituals, and guidance from medicine men or women. There are over 300 distinct languages, though many of them have become endangered or are in danger of becoming. Native Americans are recognized as sovereign within the United States with self-governance rights. They have maintained their identities even in the face of colonization, forced relocation, and cultural suppression. The Native American elderly are respected as the keepers of knowledge and wisdom. They use storytelling to preserve history, share life lessons, and pass down cultural information. High rates of violence, substance use, and suicide within some of the communities can create collective trauma that impacts any engagement in therapy.